Hello everyone, my name is Dr. Vallabh Chawla and today we'll be doing a case of dentinal hypersensitivity on a CBCT scan. Okay, so patient basically came with a chief complaint of sensitivity in the lower left side region. He was not giving a localized area of chief complaint, but somewhere on the left side he was mentioning that the pain is either on the left side or the left side upper or the lower region. So it was not localized. So we took a panoramic scout image. This is a low resolution panoramic scout image. So you can see it in the scout image. You can see some kind of blackish area, and that could be one of the cause. So just to confirm it, we took a CBCT scan also, but the patient was also complaining in the lower left side where the root canal treatment was done. So we took a scout image, CBCT scan of this specific region of the sectional scan of the lower left side, but we also partially included the upper teeth, not the root region but the crown region, to check the blackish dot which is there. So we took a CBCT scan. This is the CBCT scan which we took. So this is of the upper lower region, the root canal treated tooth. Okay, so there's the root canal status. We have mesiobuccal root, the mesiolingual root, and the distal root. And this is the upper region, which where we have partially included the crown region. So the CBCT, the roots, the endodontically treated tooth appears to be absolutely normal. There is no evidence of middle mesial canal. You can see this is the mesiobuccal root canal, this is the mesiolingual root canal, and the distal canal. So we'll just go from the axial, from the coronal region to the root region. No, there is no evidence of mesial canal. Okay, and the mesiobuccal and the distal buccal, they have a single common exit. However, there is initial pedial widening which is seen, and this is the distal root canal. So there is the distal root canal. You can just go from the occlusal to the apical region. You can check it in the axial cross sections. Okay, so again there is a single exit. You can check it in the all the cross sections by aligning the line along the long axis of the tooth. Okay, so there is the distal root canal. There is no overfill, no underfill. It is filled exactly till the apex, no pedial widening. Okay, this might be the periapical scar region, so there's nothing to worry about. It's absolutely normal. Whereas this is of the mesiobuccal and the distobuccal root, sorry, mesiobuccal and the mesiolingual root, both fill the apical region, so it's absolutely normal. You can see it. Okay, they both have a common exit. They both are mesiobuccal and the mesiolingual have a common exit. However, what could be the reason of the pain? So one reason of pain could be because there could be chance of loss of tooth structure beneath the restoration. This is the restoration. However, this thing needs clinical evaluation whether there is some kind of loss of tooth structure which has caused PDL widening in the apical one-third of the mesial root. So this could be one of the cause of any pain, no pain, but you can also say there is interdental bone loss in this region. So there are chances of food lodgement, which is giving some kind of pain sensation to the patient. Or this could be one of the reason. Or second reason could be because of the proximal caries which is present, on the distal aspect of 3-5, or the proximal caries, the mesial caries which is present on the mesial aspect of 3-7. Now whether caries are evident or not, that needs clinical evaluation, whether it's present here or here. So this basically needs clinical evaluation. Why? Because there are chances of this being an artifact also, because of the metallic restoration present around. Okay, so this could also be one of the cause, some kind of noise artifact may be present because of the adjacent tooth restoration. That's why we tell the patients to remove the metallic jewelry before the scan, but this thing cannot be removed. So this could be one of the reason. We'll just mark it over here, either this or somewhere this. But also we'll just see along, arrange the tooth along the long axis. Now we'll see the upper teeth which we have partially included. You can just see the sagittal cross sections. Okay, so in the sagittal cross section you can see some kind of radiolucency in the dentinal region. Okay, so this could be one of the cause, like it could be a dentinal caries also suspected in the on the distal aspect of 2-6. We'll just increase the thickness and see this thing. What you were seeing in the OPG scan was something like this, like you can sharpen the image. In the OPG it is not very well appreciated, but in CBCT you can appreciate it well. In 0.5 mm thickness you can just see this thing. Can see the radiolucency. Yes, now it is real evident over here. Okay, so this thing just needs a clinical evaluation whether some kind of pain sensitivity is there or not. So the chief complaint itself was of sensitivity. The patient himself wanted to go for a CBCT scan for the same. Like also there is interdental bone loss and food lodgement complaints. So this thing needs to be addressed. All possible factors, whether it's smallest caries which is present in the interdental region in between two teeth, you just have to mark it. Okay, cause number one, cause number two, it could be interdental region, or cause number three, or it could be because of the loss of structure and because of the interdental bone loss where there is food lodgement. Okay, so these are the possible causes, and then accordingly you can just study this in smallest cross sections, say 0.5 mm cross section or 1 mm cross section. That is totally your choice. Interval lines, so you can study each and every root canal status, the interproximal caries, everything can be studied. Same thing, it can be studied in the axial cross section. You just have to divide the tooth into smallest cross sections. So you can see this thing over here in smallest cross sections. Okay, and study from the occlusal aspect to the apical end region. Okay, so these were the possible causes. Also, there is some kind of apical extrusion that is noted. That could also be one of the cause. So you can mention that also. All these things can be added in differential diagnosis. Okay, so you just have to provide some differential diagnosis to the doctor. Okay, so all these are some of the causes because of which pain or sensitivity may be present.